Today I'm going to show you a patient getting her Botox and fillers. So if you aren't already doing this and you want to give it a try, you'll know what to expect. Botox is probably the most common cosmetic procedure for women. And then when you get to women that are a little bit older, it's probably Botox in conjunction with fillers. Botox is used primarily for fine lines and wrinkles, whereas the filler is used to plump up and add volume. I think in the next few years it'll become even more mainstream. I think a lot more women will be doing it. Okay, the first thing you'll do when you go for your facial injectables is you will talk with the doctor about what exactly it is you want to do. Most women want to address the nasolabial folds, and filler is wonderful for that. And then sometimes you get a little indentation or wrinkle in the center of your chin. Filler is great for that too. And then the laugh lines around the corners of the eyes and the lines on the forehead are usually addressed with Botox. Next, a topical anesthetic is applied just to make you a little more comfortable when she uses the needle. When people refer to botulinum toxin, they usually say Botox, when Botox is actually a brand name. It's a purified substance derived from bacteria, and it blocks the muscular nerve signals. This basically paralyzes the facial muscles being treated, which relaxes the muscles and reduces or eliminates wrinkles. Botox is primarily used in the upper face. Here it's being used for those vertical lines right between the eyebrows, and of course it's used on the forehead for all of those horizontal lines and around the eyes for the crow's feet or the laugh lines. When you see a woman over a certain age who has a beautiful smooth forehead, that's Botox you're looking at. But it's also used by younger women because everybody likes that smooth look, and I'd say it's probably the most widely used cosmetic injectable out there, so why not? Dermal fillers are comprised of hyaluronic acid. It's something that's naturally found in the body. Synthetic forms are used in dermal fillers to plump up the skin and add volume. Juvederm Ultra XC is the filler being used here, but there are many different brands, and they are all made of hyaluronic acid. Now, Juvederm does have some lidocaine in it, which does help make it more comfortable along with the numbing gel. Fillers allow us to replace the volume that we lose in our face as we get older. Now, dermal fillers can even be used on the lips. They're wonderful for plumping up the lips a little bit or giving a nice line to the edges of the lips, even turning up the corners of the lips, because our lips tend to turn down in the corners as we get a little older. So if you're worried that this sort of thing is about vanity, you're looking at it the wrong way. We women work so hard, we stay fit, we stay in shape, we remain active. This is just one more way to do that. And when your facial injectables are done well, you're not going to look done. You're just going to look refreshed. You're going to look great. As long as you go to a quality injector with a lot of experience, you're going to be very pleased. So let's see how it turned out. These pictures of the patient are taken immediately following the procedure. She's still red and she's not wearing any makeup, but you can already tell that the lines are filled in. There's a firmness to the face, a very youthful look. The wrinkles are smoothed out, and the wrinkles will improve over time because Botox takes a few days to really kick in. But the result is very dramatic. I know I go every 6 months and get Botox and fillers. And as far as cosmetic procedures go, it really is pretty simple. There's virtually no downtime. The only thing is the needles. A lot of people don't like needles, but after the first time you really get used to it. And the fillers are kind of cumulative. The more you do it, it stays in your face longer and you need less. The Botox pretty much dissipates within that 6-month period. So if you're not already doing Botox and fillers, I'd say, what are you waiting for? It really gives amazing results.